Hello and welcome. I'm Jackie Phillips. Everyone at Numurkah District Health Service is committed to meeting your needs with trust, respect, responsibility and compassion. Your comfort and access to quality care is of great importance to us, and we want to do everything we can to make sure your stay with us is a good experience. We want to know where and how we can enhance your care during your stay in the acute ward or theatre. There are a number of ways you can share feedback with us. They include talking with your nurse, talking with the nurse manager, asking to speak to our Director of Clinical Services. You can use our touchscreen feedback hubs to send a compliment, complaint or suggestion directly to our management team, or our paper feedback forms. You can also use the feedback section on our website. After you leave hospital, a Victorian Health Experience Survey will be mailed to your home. You may respond either online or by pen and paper with a free post return. We encourage you to complete this anonymous survey about your stay with us. Your feedback is important to us so that we maintain our high patient satisfaction. If you wish to make a formal complaint, please ask for our complaints officer, who will be happy to assist you. Our complaints officer will work with you to resolve your complaint and will provide information about the independent Victorian Health Complaints Commissioner. Thank you for taking a few minutes to watch this patient information video.
Hi, my name is Ellie Beatson and I'm a registered nurse at Numurkah District Health Service. My role is to make sure your stay with us is comfortable and safe. I'm going to talk about what you can expect from our team of staff and how you can be an active member of your healthcare team. If you are coming in for an operation in our theatre complex, you will report to the main reception before being taken into the day procedure unit. It is important to remember that if you have an anaesthetic, you are not able to drive home. Family members are welcome to wait in our waiting room or grounds. We also have some information with details of local attractions to help them fill in time while they wait for you to finish your procedure. Before you leave our theatre complex, please make sure you get all the paperwork and appointment cards you need. We encourage you to ask questions about any aspect of your care that you're not sure of. When you arrive for your stay in our acute ward, your nurse will go over the materials in your patient information booklet. This includes information on visiting hours, phone calls, mobile phone, Wi-Fi use, meals, privacy practices, and information to help you prepare for going home. If you need an interpreter, we have specialty services available for translation. We encourage you to review your patient information booklet and use the resources it offers. It is also important to note that we are a smoke-free facility. This is for your health and safety. We can provide you with resources to help if you or a loved one smoke and would like to make the decision to quit. While you are here, a nurse will come and check on you on a regular basis to address positioning, pain management, toileting and personal needs, and to review your plan of care. If you are asleep, we will not wake you unless necessary. Please do not hesitate to speak with your nurse or other members of your care team about your concerns you may have. This is an important part of our patient safety process. If you need help from a nurse outside these regular visits, simply press the call bell located on the remote by your side. Use this button to call for assistance whenever you feel you need help. For example, when you are getting in and out of bed, it's easy to slip and fall. If you feel weak or unfamiliar with the room, press the button to let us know you need assistance. We will come to your assistance as quickly as possible. During your hospital stay, you may be connected to a heart monitor, IV pump and other equipment. These devices are all monitored at all times. You may hear beeps and other sounds from medical equipment in your room and in the hall. Please do ask if you want us to explain any sounds to you. While you are in the hospital, your vital signs such as your blood pressure will be monitored regularly. Your healthcare needs may require that we wake you during the night to check your vital signs. If you feel unwell at any time, press the call bell and a nurse will attend. Educating yourself about your care is one of the most important ways you can participate in your own recovery. In your room, you will have a care board. The care board is updated each nursing shift to help you and everyone involved in your care informed about the daily plans for your care. This includes any tests or conditions we are monitoring that day. By encouraging you to be involved in your own safety, we hope to improve the hospital experience and ensure the best health outcomes are achieved. There are 8 simple steps you can follow to keep yourself safe during your hospital stay. Take a look at this airline-style patient safety video for an explanation of each step.
Welcome to our hospital. While you're here, your safety is our priority. And if you followed these 8 simple steps, you can help keep yourself safe during your stay. To prevent falls, please wear the hospital socks if provided, laced up or snug-fitting shoes or slippers with rubber soles. Use your usual walking aids, and if you need any assistance, tell us. To help prevent blood clots, wear your hospital stockings if you've been advised to, and move as often as you can. Try to do simple leg and ankle exercises. Drink fluids as recommended. And take blood-thinning tablets or injections as advised. To prevent infection, wash your hands before and after visiting the toilet and before all meals. Don't hesitate to ask our staff if they've washed their hands before any contact with you. Tell us if you have diarrhea or vomiting. If you have tubes or needles attached to you, ask staff why they are there and if you still need them. There's no need to be confused about your medicines. Tell us if you don't understand what your medicines are for or if you have an allergy. Talk to your doctor, nurse or pharmacist about any concerns you may have and ask about possible side effects. Pressure ulcers are not very nice, so if you can, try to keep mobile in bed and call us if you are uncomfortable. We are very happy to help you change position, and if necessary, we can provide you with a special mattress or cushion for support. Let us know if any of your personal information is wrong, like the name on your ID band, your address, your GP or your next of kin. Also tell us if you have any allergies. If you have any concerns, don't forget we are here to help you. Talk to us if you have any worries or questions about your treatment or about what will happen when you leave hospital. Congratulations, you're leaving the hospital. But before you leave, make sure you have your discharge letter, you've got your medicines, and they've been explained to you. You know who to contact if you have any questions or concerns, and you know when your next appointment is. If you need any more information on how to make your stay with us safe, read the booklet provided or ask a member of staff.
At NDHS, we encourage you to choose a support person or substitute decision maker, which may be a family member, caregiver, or close friend that you can trust and that you can communicate well with. Your support person will be a spokesperson if and when you need one. You and your support person play a vital role in making your care safe by speaking up if you have any concerns or questions. They will help us maintain your privacy by acting as a designated contact person to share information that you want with other family member and friends. We also recommend completing an advanced care plan to legally declare your choices about medical treatments in the event you are unable to make these decisions yourself. We want you to recover as quickly as possible so you can return home. You will be able to return home as soon as your doctor deems it medically appropriate. We will work with you and your family regarding optimal time for you to leave the hospital. When it's time to leave, you may not feel that you are fully recovered. Our primary health staff will help you determine what you need to support you at home and to access these services. We will provide you with instructions and information about how and when to take your medications and what to do to rest and heal. Please ask questions if something is confusing you or you need further information.
It is an honour for us to care for you during your stay. We encourage patients and their families to feel comfortable discussing any concerns about safety with their care team or management. You and your family know your health best and should always alert staff if there are concerns about your well-being. The doctor or nurse will talk with you and assess your health, providing feedback to you and your loved ones. Remember, it's always okay to speak up and ask questions.